Welcome to City and State's latest online discussion on the coronavirus pandemic. Our topic today is New York's most vulnerable populations. I'm John Lentz, City and State's editor-in-chief, and we have a lot of ground to cover and only an hour to do so. So we'll share the bios of our panelists with links in the chat room if you want to read more about them. Today, I'm pleased to welcome Dr. Oxiris Barbot, Commissioner of the New York City Department of Health and Mental Hygiene, Lorraine Cortés-Vázquez, Commissioner of the New York City Department for the Aging, New York City Council Member Francisco Moya, whose Queens District has been one of the most hard-hit regions, and the council member will be joining shortly. He's running a little bit late. Also, I'd like to welcome Dr. Talya Schwartz, President and CEO of MetroPlus Health Plan, and Anderson Torres, President and CEO of Rain Total Care, a nonprofit organization. But first, a word from our sponsors today. This webinar is sponsored by MetroPlus Health. MetroPlus Health has been serving New York City for 35 years and is here for you during these unprecedented times. It's also brought to you by Rain Total Care. Rain Total Care, Inc.'s mission is to enhance well-being and quality of life for those in need by meeting the interim needs of people of all ages. They provide in-home and personal care services for the disabled, elderly, and homebound individuals of any age in the 5 boroughs in Lower Westchester County. Finally, there's a few functions on Zoom I'll point out for our audience. To ask a question, click on the Q&A button at the bottom of your screen. We'll take a few audience questions at the end as time permits. And you can also interact with the other attendees using the chat function. You can use the drop-down box to share comments with all attendees, not just the panelists. And please do keep the chat discussion civil and on point. You can also change the view settings in the top right-hand corner of your screen. Settings may also be different if you're on an iPhone or mobile. Finally, back to our guests. And Dr. Barbot, since you're on the front lines here as much as any public official in New York, we want to start things off with a few questions just for you. So the first question, you spearheaded Take Care New York 2020, hashtag TCNY 2020, billed as, quote, the city's data-driven health agenda focused on addressing the social determinants of health and engaging communities on the issues of health equity. Now I have a two-part question there. Did the city make clear, measurable progress on this front? And now, given this deadly coronavirus pandemic and its disastrous impact on the economy, how far are we set back? In short, will any hard-won gains be completely erased for months, if not years to come?
John, thank you for that question. And I think that it is abundantly clear that the underlying drivers that have contributed to health inequities that we were trying to address through Take Care New York have absolutely wreaked havoc during this public health emergency. And that we are seeing the effects of these inequities played out in the fact that our most under-resourced communities, by and large, are the ones that are seeing the highest burden of deaths related to COVID-19. Black and brown New Yorkers are dying at twice the rate as white New Yorkers. And I have no doubt that that in part is due to the underlying drivers, things like insecure housing, things like lack of economic opportunities. All of those wrapped in structural racism are really playing out in this public health emergency.
Sure, and you mentioned those racial disparities. We've seen a lot of coverage of that. You know, much higher infection rates among immigrants, racial minorities. Is this something that could have been predicted? Is this something that exposed long-standing underlying fault lines in our city?
You know, let me start off by also saying that there is no underlying biologic reason why Black and brown people would be dying at different rates, right? This has nothing to do with race in and of itself, because as we all know, race is a social political construct. It's not a biological definition. That being said, we do see higher density of underlying chronic illnesses that could put people at higher risk for dying from COVID-19, such as diabetes, such as heart disease, kidney disease, etc., all of which are hitting communities that have been historically under-resourced harder than other communities. And I think there are challenges to teasing that apart, but the reality is that during our response right now, we are using the data that we are reporting on to certainly help inform our response to make sure that we are addressing all corners of the city, but especially those communities that are hardest hit.
Sure. And a follow-up there, to what degree are any kind of disparities or gaps due to lack of education, getting the message across, a lack of awareness or compliance? For example, the nonprofit news site The City recently reported on the strikingly different outcomes in Flushing and Corona in Queens, two neighboring neighborhoods that are similar socioeconomically. They reported, and I quote, "The divergent impact of the virus in two similar neighborhoods suggests that low incomes and poor access to health care alone do not predicate the virus's damage. The divide between Corona and Flushing also highlights a striking possibility. The early measures many Flushing residents, workers, and businesses took to protect themselves during the crucial weeks while the city and state government held back may have made a difference." Not sure if you saw that story, but any reaction to that or commenting on that really striking difference between those neighborhoods?
You know, from the very beginning, we were focused on blanketing the city with prevention messages, ensuring that New Yorkers knew that the best way to protect against COVID-19 was the foundation of good hand hygiene, covering your mouth and your nose when you coughed, and seeking care. I think it's, clear that we didn't also take for granted that there were certain communities that needed additional outreach. And so we've done a significant amount of outreach with ethnic media. We have developed all of our materials in multiple languages, over 15 languages. We're doing outreach with robocalls, direct mailings. And so to the degree that different parts of the city had different experiences, I think is probably a combination of multiple factors, but certainly we are taking nothing for granted, right? In this situation, we can't take for granted that the way in which we blanket the city with messages, either in social media, either in TV, whether it be English, Spanish, Chinese, we're not taking for granted that that's really reaching everybody. We're taking additional measures to ensure that we leverage the voices of trusted leaders in communities. We're doing teletown halls in all manner and shape with faith-based leaders, elected officials, et cetera, to make sure that every community is reached with the messages that are going to be life-saving.
Sure. And you're a member of the de Blasio administration. Obviously, Mayor Bill de Blasio came into office with the Tale of Two Cities and has really focused on equity and closing the gap between the rich and the poor. We've seen off and on stories about how the wealthy seem to have better access to healthcare in this environment. I mean, more broadly as well. Early on, they could pay more money. They could get that early test to see if they had an infection. Going forward, as we develop treatments, vaccines, whatever comes down the road, how can we ensure that this kind of care reaches the most vulnerable and not just the richest? And anything specific about what the city can do on that front?
Yeah, that's a great question. And I think one of the things that this city is really leveraging and lucky to have is a robust system of public hospitals. And these hospitals, when the administration came in, and rightly so, invested significantly ensuring the viability of those hospitals. And I think that, where we are seeing high levels of transmission, we are also seeing H&H hospitals to provide that ongoing care. And it's important for people to know that H&H provides those services irrespective of immigration status, irrespective of insurance status. and that they have been at the forefront of ensuring that our communities have access to life-saving measures, all the way from ventilators to ensuring that medications such as remdesivir are available. But clearly, that being said, we do have issues around ongoing access to care, right? And for example, you know, now that we've got many people out of work, one of the things that I ask myself is, how long will we still have employer-based health insurance? When is it that we as a country are going to be moving beyond having a job be the only way in which you can get health insurance? And so I think there are lots of policy questions that are being raised by this public health emergency, some of which we are fortunate enough here in New York City to have addressed, you know, through NYC Care and H&H. We're providing care to all New Yorkers, irrespective of insurance and immigration status. But clearly there's a lot more that we need to do. We're launching supports with smaller community-based clinics all around the city and neighborhoods that are hardest hit, and that's rolling out. So I think there's a lot more to be done, but certainly we are at the forefront of this.
Sure, and we'll hear more later on in the program from Dr. Schwartz, who's at MetroPlus, which is part of Health and Hospitals on that front, and the effort predating this pandemic to expand coverage in the city. But another thing on Health and Hospitals, not to get into the politics of it, but there was a recent news that contact tracing was going to be done in the city through Health and Hospitals. Just in terms of the policy aspects here, I understand there will be some kind of partnership. The health department, you know, staffers will still be involved in contact tracing. And if you could just kind of walk through some of the brief details there on how that's going to play out.
You know, John, we at the health department have a long history of being involved and bringing to an end epidemics that have affected the city, from TB, HIV, and most recently measles. And I'm really proud of the staff that we have and the years of experience that they have in providing, doing contact tracing. We will continue to partner with our sister agencies, because from the beginning we have said that this is an all hands on deck approach, that there is no one single agency that's going to bring this pandemic to an end. It needs all of us. And so we're dedicated. We're committed to ensuring that our world-class experience in contact tracing continues to be put in service of the health of New Yorkers.
Sure, and one last question for you before I pivot to a few other panelists. Not only is there a crisis in terms of public health, but there's the ensuing economic recession. We're likely in a recession at this point. How will that make things even worse? You know, there's budget cuts pending, high joblessness. You see these stories and photos of long lines, people lining up for food pantries. I guess from your perspective, the Department of Health, how do you prepare for that, medium and long term? Surely there will be health impacts from the economic problems as well.
Yeah, no, you know, I think that that's really a critical question, because right now, part of what will make our success in terms of bringing this public health emergency to an end is the degree to which we make it easy for people to remain in isolation. Once they have been diagnosed with COVID-19, the most important thing is for them to remain in isolation. And so, you know, for example, if someone doesn't have stable housing, if someone doesn't have ongoing income, it will make it that much more difficult for them to safely and consistently remain in isolation. And so, you know, as a city, we are partnering with our federally qualified health centers, and we are looking to secure and have secured hotel rooms for those families where they may not have stable housing, individuals who may not have stable housing, to ensure that those don't become significant barriers for them to remain safely in their homes. But the reality is that we will need the support of all New Yorkers in ensuring that we provide for one another. One of the things that we have said from the very beginning is that we're all in this together, and it's going to take all of us to bring this public health emergency to an end. So I am very concerned about what the economic impacts will then ripple towards bringing this pandemic to an end in our city.
Thank you. And over to you, Commissioner Cortés-Vázquez. I want to turn to you next. Well, the health department doesn't deal directly with nursing homes. This is a critical policy question. We've seen a lot of coverage about the number of deaths in nursing homes in New York City, across the state. Many vulnerable New Yorkers are housed in these homes. There's been calls for more transparency. For some time, we didn't even know how many people were dying in nursing homes. There's been calls for greater oversight. But from your perspective, what kind of change, if any, would you like to see in terms of caring for the elderly?
Thank you for that question. I've been a long proponent of community care, long-term care in the community. And I think now is the time, it's an appropriate time to start reevaluating the various models we have for long-term care for older New Yorkers. That being said, this is an unprecedented time, and you know that we have had to reimagine and redesign and recreate many of our aging services, primarily because we instituted a law on March 15th, both at the state level and the city level, that older New Yorkers were to stay at home. And the heart and blood of the heart and soul, I would say, of aging services have centered around congregate sites where people go for nutritional services as well as recreational and educational services. So we had to recreate those and transfer those from local, community-based, small-scale operations to a major operation of providing food for the older person who sometimes gets their primary nutrition at a senior center. So from the very beginning, we had two things in mind. One was food, to address food insecurity, and the other companion part to that, what for us was social engagement, because we were very concerned and still are very concerned that we must combat social isolation because of the long-term impact that it has on older New Yorkers. And so we transitioned. We went from a congregate setting to a major direct meal with last mile delivery, which was a major challenge, was to get that meal in the hands of the older New Yorker, because we've had a strong partnership with the Department of Health. And the Department of Health from the very beginning gave us all of the guidance, and we redesigned our programs based on the guidance that was coming out of Dr. Oxiris' shop. And one of them was older people need to stay at home. And that was a major undertaking. Usually at senior services, we would have 21 to 25,000 people on a daily average attendance. So how do you turn that into a direct delivery? That was a yeoman's task. We did it. And immediately we knew that the demand was going to outpace the abilities. So we went from 25,000, which was our average daily attendance, to 44,000 people within a week's time. That's why, and we know that demand and that need is going to be greater and continues to grow every day, because people like myself, who have always been independent, who is over the age of 60 and has never relied on services, might find themselves more dependent or food insecure or unable to go out and handle their daily life activities. And so that is why that grew so exponentially, and it continues to grow.
Sure, and I want to follow up on the food aspect of this momentarily, but both for you, Commissioner, as well as I think I'll try to loop in Anderson Torres as well. Senior centers, when will they open? When should they open? Similarly for cooling centers, any sense, you know, it's gonna be another hot summer. When and how might those open, or what are the alternatives? And Commissioner, back to you first.
Yes, absolutely. And then I go back to Dr. Barbot, because all of our guidance is directed from a health perspective. And when it is safe, and what I can say is as the social distancing requirements get reduced for other populations, and Dr. Barbot can speak to this much better than I can, my hunch is that the tail will be a little longer for older adults, so that we will probably not be allowed, or should, and we would recommend strongly not to have congregate settings, and definitely not congregate settings as we knew them in the past. So I will give that back to Dr. Barbot, but that is who guides us and makes those decisions, and that we follow very, very carefully.
Sure, Dr. Barbot.
Commissioner Cortés is absolutely right that when we are ready to, as a city, start lifting measures, and we will do that in a very gradual way, we will continue to cocoon our elderly and make sure that we protect them until we are assured that it's safe for them to reintegrate into the whatever new normal we move into. But yes, that's absolutely right.
Sure.
Right, and so I'll go back to the whole notion. So Anderson, at some point you can jump in, but it will take us a while to start looking at when and if we can open, what will that look like? And we're looking at that right now and making some plans, alternate plans. We have a plan A, we have 4 or 5 different scenarios that we're looking at when we can open. But to answer just directly your cooling center question, that will have a major impact. So again, we're looking at alternatives to cooling centers for older adults. We're looking at individual air conditioning and looking at different type of cooling centers that we have had in the past. So all of that, John, it's thoughtful, good questions, and all of the things that we're preparing for and planning for and developing designs for, because we don't know what the future holds, but we know that we have 4 or 5 different options that we're planning for.
Sure. And Anderson, if you want to follow up on any of that first, and then secondly, you have your program has 13 senior centers that have been closed. If you could talk about how you've been creative to try to still serve those clients, your population. Sure. Over to you.
First of all, let me say happy belated Mother's Day to all the mothers in the audience and to all the moms in your lives. Definitely a very different way of celebrating this major holiday. Say amor a la distancia, right? Love at a distance, and it was a very interesting experience, especially for all the seniors that we're serving as well. Following up on Commissioner Cortés-Vázquez's statement and Commissioner Oxiris Barbot, we have to also follow policies and procedures dictated by the New York State Department of Health, which trickles down locally, because the last thing we want to do is to jeopardize anybody's life and well-being, and that is mindful. But I also have to share with you that just before jumping on this webinar, I was speaking with a senior who is still very active, working actually, and she says, quote unquote, I am not made for this. But at the same time, she says, I live with my granddaughter. She's lived with me since birth. And when she comes home, she says, where are you, Grandma? If she's in the living room, then she'll go to the kitchen and vice versa, because she's afraid of posing a risk for her grandmother. Now, the seniors are beginning to express some concern even in a reentry. What does that look like? Because they're also fearful of being infected. And many of their loved ones in the community, friends, neighbors, and so forth, have been impacted. I just heard a story recently of a senior with Alzheimer's who had been going to her bedroom where her husband was laying down for 3 days and he had expired. So these are realities and stories that we're hearing about. I recently heard Commissioner Cortés-Vázquez on TV talking about mental health. And we definitely see such a high level of anxiety, depression, PTSD, resonating in the community. And on top of social isolation, what to do. So we've been working very closely with the New York City Department for the Aging, with the staff and the commissioner's leadership. And, with the friendly visiting program, the friendly calls and so forth, that's helped tremendously in terms of, seniors being connected with someone the old fashioned way over the phone. I don't know if you all remember growing up and you would hear the mystery events and all that over the radio, leaving it up to a lot of imagination. That's a way that they've been able to engage. And the most difficult is when you have to hang up and they want to continue speaking, because that perhaps may have been the only connection that they've had during the day in light of this isolation. They say we remember the fun days and the fun times at the senior centers, where in one senior center on a given day, celebrating a birthday, we may have 130 people gathering. What will that look like? Because it seems like that is not a possibility in the very near future. It's as Commissioner Cortés-Vázquez said, reimagining, and then we have to retool our workforce to adjust and transition into that new way of delivering services to a community.
Thank you so much for that, Anderson. I just want to, John, just add a little more content and dimension to that. I think we're getting a glimpse into what that future may look like. Right now, we have 171 programs, meaning agencies, that have turned into, and Anderson's group being one of those, that have turned a lot of their congregate services into virtual training sites. And so we have this robust program where over 1,600 people a day are participating in Zoom classes, yoga, art. So that someone is even doing magic shows. So there has been a very creative approach to taking services and making them virtual. And then to build on something else that Anderson said, it's these wellness calls with the Department of Health, who has been a great partner, and New York City Service, as well as the 300 service providers. Over 16,000 people a day are getting just a check-in. Some need more services. Some need more than just a hello, check-in, how are you doing? But we know that there is a vast outreach. So one of the things I'm going to ask is for any New Yorker who wants to participate and will get training by the Department of Health and the Department for the Aging on being part of that core of New Yorkers who is active and involved in making sure that we can continue this wellness reach. We have 1.6 million people who are out there that we can reach and communicate with. So I will give you a number later on, but that is a glimpse of what our new normal may be looking like.
Surely, thank you. Council member, wanted to get you into the mix here. Thank you for your patience. Part of your role in the New York City Council is providing oversight of city agencies, using your position to call for action at the state and federal level as well. Broadly, how well has the government been serving vulnerable populations, including undocumented immigrants in your district? What, if anything, needs to change?
Sure. And thank you, John. Thank you for having me. And of course, to all the panelists, it's great to be part of this. Look, I'm born and raised in Corona, Queens. To me, this is home, but it's also truly where the epicenter of COVID-19 has taken place. We've seen the disparities that have really demonstrated the huge economic gap between the ultra wealthy and the poor. Just to go to a point that Dr. Barbot made earlier, and thank you, Doctor, for the great work that you've been doing. But I just wanted to say a couple of things here, because this really is going to highlight why this is happening in communities of color, especially the Latino community. for me in particular, what we've seen and through the Bureau of Labor, their statistics showed that only 16% of Latinos in New York City were able to telecommute from home. Why? Because they're in the service industry or in the hospitality industry. Most of them are undocumented immigrants. These are the individuals that, you know, didn't sign up to be on the front lines. They're the ones that are delivering food to our homes while we're self-quarantining. But they're also the people that are manning the registers and stocking the aisles in our supermarkets. They didn't have any PPEs. They're also living in multi-generational homes, right? Like in the Latino community, it is like where I live, I have a two-family home. I take care of my elderly parents. My father suffers from Parkinson's. I was very concerned about that because of what Dr. Barbot said of the underlying health issues that really impact a lot of seniors. But at the same time, you know, we needed to really get that information out much earlier. And that's where the difference is, I think, for me, where in communities like ours, especially where social distancing is something foreign, you know, we greet each other with a hug and a kiss. It's a sign of respect. Social distancing is something we don't know. So that is why we really needed to communicate better to our neighborhoods, because that was something that could have helped, I think, the way we are able to really teach people how to really be careful and really do their part to prevent the spread. So when we see all of this, it's also going back to, like, this isn't new for us. Look, I was born in Elmhurst Hospital. I worked at Elmhurst Hospital. I represent Elmhurst Hospital. Elmhurst Hospital has been busting at the seams for a number of years. Now, last year, I was able to put $5.5 million to expand their emergency room. On a regular day, they're at 80% capacity. During the first tidal wave that came in, they were at over 120%, right? Like, these are the problems, is because we don't have access to healthcare, especially if you're undocumented. Now, the city has been doing a lot to kind of change that, really offering services that would really help a lot of the undocumented community, talking not just about being a sanctuary city, but also talking that our public hospitals are safe spaces for undocumented individuals to go to. You know, there was, since this president has taken over, we've seen ICE in the courthouses, ICE in front of our local schools, in the hospitals. I think part of what we have done, I think, is to demonstrate that the public hospitals would be a safe space for undocumented immigrants to go. But we need to do more, because this isn't over, right? Like, we may see the flattening that's happening right now, but we don't know what's going to happen in the future. And we need to be ready to really take care of those that have suffered the most here. And one of the first things that I really started talking about was the burial assistance fund. Really, you know, being out here in the front lines, you know, we who have been in public office, we've heard plenty of stories, you know, that really have an impact on us. But this one was really difficult for me, that moved me emotionally, when we got a call from a constituent that was calling on behalf of a young child. The mother had passed away from COVID-19. The father was on a ventilator, not going to make it. This child was going to be left orphaned. The hospital is calling them, you need to pick up the body. They don't have the money. We started doing a little bit of our own investigation from our office. We found out HRA offered a burial assistance fund, except it was a reimbursement fund that only went up to $900, and you needed a social security number. So the vast majority of folks that were dying were undocumented immigrants. And those who don't have the financial wherewithal to provide for a funeral. We know for a fact that funerals are very expensive. They're running, you know, above $3,000 to $4,000. If you're not working, if you can't pay the rent, if you can't pay for food, how are you going to pay for burying a loved one? And so with the help of Speaker Corey Johnson, we really pushed to get an emergency fund going for this burial assistance program. And I have to thank the mayor. We made an announcement last week where now HRA, and it's going to be through partners, individual community-based organizations working with the Mayor's Fund in the city of New York, that will provide access for undocumented immigrants or people without the economic wherewithal to be able to apply to get burial assistance. And it also really removed the cap of being just $900. It can go up to $3,500. And it also was paying for cremation, where it didn't do that before, because a lot of folks that were undocumented, the only way to be able to repatriate them back was through cremation. And so we've seen that kind of struggles that were happening and why we needed to fight for those issues. And now we're seeing the second part of this, right? Which is access to food. And it's something that we would never have imagined that we would be in New York City seeing the lines that we're seeing for people just trying to get food, right? It's what we're accustomed to seeing in third world countries, in war-torn countries, but it's happening right here in our neighborhood. With the city council, we put in $25 million for emergency funds to fund our food pantries. Why? Because there's a necessity here. You know, we need to ensure that every New Yorker, and I know that the mayor has been talking about this, that we have access, that all New Yorkers have access to food. You know, John, you brought this up. We cannot afford, or our folks can't afford to go to their second homes in the Hamptons or in upstate New York. They're here. And what do we have? We have a real struggle. And we have to make sure that we are doing our part to ensure that all New Yorkers, regardless of your economic status, regardless of your social security status, that we are taking care of those people that have really been suffering the most. And that's what we're trying to do as we prepare for our budget that is coming up in the next month or two.
Sure. A quick follow-up on that before we get over to Dr. Schwartz. And Commissioner Cortés-Vázquez, you were talking some about home-delivered meals for seniors. There's this transition from DFTA to the overall emergency food program. How has that transition gone? Are there seniors that are still struggling to get food in this city?
So I want to make sure that we separate the two programs. We have a traditional home delivered meals program for the disabled and infirmed older person. That program has been intact since the beginning. We have not included that in any of the transitions for food insecurity. We wanted to make sure that nothing compromised that program, because these people were vulnerable before COVID, post-COVID, and during COVID, they're even more vulnerable. So I want to just separate that. In terms of, we knew that 44,000 people a day was not going to meet the needs of older persons. And so as the demand grew, the program was transitioned to Get Food New York. As the council member so aptly said, we were stunned by the demand for food insecurity. Not stunned, but I think we were surprised how quickly it grew. And so today we find ourselves in that larger food insecurity arena. So Get Food, the mayor's food czar, is handling right now all of the food transition. Fortunately for us, we negotiated a good deal that they would grandfather in the 44,000 that were already registered so that they would not have to go through any re-registration. They also have been able to provide 3 meals a day, while under the direct plan, there was 1 meal a day. So they've increased capacity and they've increased scope. And we find every day more and more older people. If you're 60 and over, you call 311, or you can call your local senior center and they can enroll you in the food program that's run under Get Food, under the Food Czar right now.
Sure. Thank you, Commissioner. I want to jump over to Dr. Schwartz. Again, thank you for your patience. Dr. Barbot referred to this earlier, the city's health and hospitals, and you run the city-owned insurance plan that provides low-cost coverage. what are you seeing? Are people who are newly unemployed flocking to your plan? How are you reacting? And I think we talked earlier about some efforts that your plan made before some of the private plans that are out there.
Right. So yes, we're seeing the tremendous demand for health insurance, given the circumstances. As Dr. Barbot mentioned, a lot of people lost employment, and with their employment, they lost their health coverage as well. So in the past couple of months, we have seen tens of thousands of people come to us seeking insurance. Additionally, people who had insurance with premiums are not able to afford the premiums any longer because of change in their employment, whether they lost their employment or there's a reduction in their income. So we are proactively helping those people to screen and then, if eligible, to qualify for no premium or extremely low premium health coverage. We do this both as in a reactive manner where people are reaching out to us, but also proactively reaching out to our former members or members who we know could not afford insurance and reassessing them and helping them to get covered. Obviously, it's a critical need given the circumstances. In addition, the state extended its special open enrollment period where people who qualify for the QHP type of coverage can now enroll. This special enrollment period is open through June 15th. And so those New Yorkers who do not qualify for no premium or low premium, such as Medicaid and EP, plans can apply for the QHP qualified health plan insurance through June 15th. So that's an important opportunity. In addition, outside of health insurance, as many of the panelists mentioned, there are other tremendous socioeconomic needs, especially in our insured population. A significant portion of our population are minorities. As soon as the pandemic started, we screened our population and identified who are at the highest risk to be negatively impacted by the pandemic. And we identified approximately 85,000 New Yorkers who are at a higher risk of being impacted by COVID. And we started proactive outreach with the assistance of Amazon Web Services, Bain and Air NYC. We all joined forces and started reaching out proactively to New Yorkers, not only to make sure that they know where to go if they have symptoms and what to do and what not to do, but also identified any other needs. And as was mentioned before, frequently we identified needs with access to food for vulnerable New Yorkers, especially senior New Yorkers, but not limited to seniors. We also saw requests for assistance with unemployment application. I think it's no secret a lot of people were waiting for a long period of time to contact the unemployment centers and qualify for unemployment. So we assisted with that as well as with any other needs that they have. We activated a home delivery service that we have in place during regular times, but we really ramped up the food delivery services to our members. Again, a lot of the seniors, but not limited to that. And finally, we have a member rewards program where members can get rewards points for doing preventative care. Well, obviously not a lot of preventative care is happening right now. So we diverted those funds and started sending food boxes to our members, specifically for people who need assistance with basic activities at home, but also identified zip codes where we know the need is the most acute, and started sending those food boxes to our members to really do our part in supporting New Yorkers and the struggle.
Sure. And Dr. Schwartz, you were telling me earlier, think you've also launched telemedicine during the midst of this pandemic. And I wanted to start with you, but also pose that to the whole panel, the role of technology. You know, it's not 1918 when we had the Spanish flu. There's a whole host of different technologies today that can help in different ways. And yet, you know, we're talking about vulnerable populations. There's a digital divide. There are, you know, many low-income or New Yorkers or undocumented immigrants that might not have Wi-Fi or be able to afford a smartphone. But I guess, Dr. Schwartz, start with you on the rollout of telemedicine, and then turn it over to anyone else on the panel on technology.
So that's true. We pushed up the release of our telemedicine services. We made sure that those services are free of charge. They're free of charge now during the pandemic, but they're free of charge, period, because we want to encourage our members. As I mentioned, a lot of them are vulnerable members, minorities, to access care as much as possible. And we know that helps with access to care, especially for people who work long hours, work you know, double shifts. They do not always have the ability to access services, but the services are available. So with that in mind, again, even prior to the pandemic, we decided that we wanted to offer free telemedicine services to our entire membership. But with the pandemic, we worked very hard with our vendor. We're able to launch it earlier than expected. And we have seen a tremendous uptake. We actually initially launched just for the seniors as a priority to make sure that there's adoption and people are starting to use it. And we saw tremendous adoption. In fact, it's so high that now the vendor wants to do a case study to see why is there such tremendous adoption. They've never seen anything like it. Obviously, there's tremendous need. But we're very proactive, making sure that our members know that those services are available to them. If we have any kind of contact information for them, we email them, we text them, we let them know that those services are available, and proactively promote those services so that people not only address the concerns that they have around COVID, but also take care of other conditions that they're struggling with and may not necessarily get care for right now. So I know that others on the panel are concerned with this as well, where we're seeing people not receiving chronic care, kids not receiving the immunizations they need to receive, and concerns about kind of a secondary significant impact of what's happening now with the shutdown.
Sure, thank you, Dr. Schwartz. Just a quick note for our audience. If you do have any questions, we're getting some good questions in the chat room, but if you can add your questions to the Q&A, we might be able to get a couple of those in before time runs out. But then back to the panel, any follow-up to what Dr. Schwartz was saying?
I want to underscore again the use of technology. As I said before, we had only about 29 programs who were involved in virtual programming, and now we have 171 programs involved in virtual programming, bringing a rich array of art and culture, education and information to our older population. And I think that is going to be our new normal. I think there's just going to be enhancement of that. Fortunately for us, there is a high participation rate of older New Yorkers with telephones. So which makes our telephone reassurance, our friendly visiting, our wellness connect, all of those calls and reaching out to, don't touch, but reach out to an older person, and it makes it possible.
And John, the only other thing that I would add is that I think that we're in a transformative moment, and it really shows not only the resiliency of New Yorkers, but the adaptability of New Yorkers. And telemedicine is one of the ways in which we can all adapt to the circumstances that we're living under. And just, you know, want to remind folks that telemedicine isn't just about video, it's also about telephonic services. And I think we need to think about how we then continue extending these services beyond this public health emergency and incorporate it into whatever more just and equitable normal we will live into, because it's a way of increasing access to care. And so, you know, it's sort of interesting how this is all evolving, and the ways in which, you know, barriers in the past are no longer barriers, and thinking through how can we continue supporting communities beyond this initial period, because, you know, it's sort of inevitable that as we reopen and start lifting social distancing measures, that we will get an increase of more COVID cases. And the question is, what can we keep in place to ensure that we minimize whatever additional cases we get in the future?
Sure, a quick follow-up on that, Commissioner. We're getting a lot of questions from our audience about what is the new normal going to look like. You read about things like widespread temperature checks, a huge level of testing, maybe even certificates for people that have antibodies, masks everywhere. What do you see? Which of those things, or which other things, might just become normal going forward?
You know, I think we are still in the development phases, but one thing I anticipate is that the use of face coverings will be something that remains for the foreseeable future. The emphasis on hand hygiene will remain for the foreseeable future. I think one of the cultural changes that I hope will happen as a result of this is that we won't sort of continue adopting the tough it out mentality of when somebody is sick, you know, they feel they will get judged if they don't come to work, and to really understand that we are mutually accountable, that people who come to work sick are putting other people at risk. People who go outside sick without wearing a face covering are putting others at risk. And I think, you know, the degree to which we embrace our interdependency and how we are mutually responsible for each other's health, I think is going to be certainly a part of whatever future normal we may live into.
Sure. And two quick audience questions for you, Commissioner Barbot. Please comment on the advisability that people refrain from smoking and vaping, since anyone who gets infected with COVID-19 will most likely have a more severe case due to the smoke/vape minimizes lung functions.
Well, you will never find me turning down an opportunity to tell people not to smoke. And so certainly if there was ever a reason to stop smoking, to not start smoking, to stop vaping, it's certainly this one. You know, I understand that breaking the habit of smoking can be extremely challenging. There are resources that are available, certainly through entities like Metro Health. There are reimbursement opportunities for stopping smoking, but I think this is yet another opportunity to ensure that New Yorkers continue the downward trend of not smoking.
Sure. One last topic I wanted to hit on, homelessness. There's been a lot of coverage of you know, the homeless. They're now getting removed from the subways. You know, many of them don't want to be in homeless shelters. How well is the city doing on that front, on serving the homeless community? Maybe council member, if we could hear from you.
Sure. Look, I think we have a serious crisis on our hands with our homeless population. You know, we need to also be thinking about protecting the workers at the homeless shelters, as there's this transition that is happening right now, that the mayor is looking to put the homeless population into hotels now. It is extremely important that PPEs are given to the individuals that are working in these facilities. To me, you know, if we can't protect the most vulnerable, we're going to fail as a city if we don't do more in curbing the homeless population that we have right now. We also know that a lot of homeless families are in desperate need. It's critical that we look at how we are going to sort of be able to transition from the shelter to emergency housing for a lot of these families that are in homeless shelters right now. It's extremely critical, I think, for us to get young kids and families and young moms and dads out of that system. We also know that for a fact that there needs to be a lot more that is being done for those that are suffering from mental illness. A lot of the homeless population that are sort of in the subways and out in the streets have some real mental health issues. We need to open up our ability to really reach out to them in a real way that is going to help them in this time right now that we're facing. And part of that is making sure that cuts aren't going to come to the programs that really would be able to have a profound impact on our homeless population at this time.
Sure. I'm glad you mentioned mental health. Unfortunately, we didn't have time to discuss that, but I'll note that on June 2nd, we do have a panel, another webinar on mental health with Susan Herban of Thrive NYC, New York City Council member Diana Ayala, chair of the Committee on Mental Health, Disabilities, and Addiction, and the State Office of Mental Health Commissioner Anne Marie Sullivan. So tune in June 2nd for further discussion there. We're about out of time, but I wanted to pose one last question. You know, if you're not in government or you're not maybe working for a nonprofit, what can you do to help serve the vulnerable, these various vulnerable populations?
John, thank you for the opportunity. I will never miss an opportunity to give a phone number where any New Yorker who wants to help and get involved in older adult programming, or any older adult in New York who wants information on what the services are, I'm going to give you a number. So everyone mark this number down. It is 212-AGING NYC, 212-244-6469. It will give you access to all of the services that I mentioned before when there are. You don't have to be a senior center participant to get information. And it'll also give you access to, if you want to be a volunteer, be part of the wellness, please call that number. The other thing is, of course, you've said it before, Susan Herman will be here and Council Member Diana Martinez. But NYC Well is a number where any New Yorker who is feeling stressed or in need of support should just call that number. There is someone available to you in multiple languages, just to be that voice and that ear that you may need for that moment. So it's NYC Well.
Sure. Any other suggestions, advice?
And look, just to piggyback on that, I think it's also, folks should look up their local food pantries, how they can donate. We've been getting a ton of calls from a lot of New Yorkers that are just, hey, how do we help, right? And whether it's volunteering to help distribute the food, or whether it's just an actual donation that goes straight to your local food pantry. That's really critical for us right now, because we know that there's a lot of New Yorkers. And look, what makes us New Yorkers is that in times of crisis, like, we just see the best in people, and they want to do something to help their fellow man. And I think for us, you should reach out to your local council member, local elected official. As the commissioner says, always love to give out a phone number. So 718-651-1917. We are operating remotely, but you can call our office for resources. It's really important that you reach out locally to get involved, because it can really make a difference in someone's lives right now. And I think that is the main thing for folks, that they get involved in their local communities to do something positive.
Well, thank you to our audience. We're just about out of time. Thanks again to our sponsors, MetroPlus Health and Rain Total Care. One other note, we'll be holding a discussion on education on May 26th with Regents Chancellor Betty Rosa, Councilmember Mark Traeger, and John Liu, the chair of the State Senate New York City Education Committee. Thank you all for tuning in. And of course, thank you to our fantastic panelists.
Thank you for having us. Thank you.
Thank you.
Thank you for having us.
And that concludes our program.